Thank you, sir. All right, so looking at this 4 lead, I'm seeing a little bit of irregularity.
Okay.
Emergency medical services is the provision of primary medical care in the pre-hospital setting to individuals who have suffered a medical or traumatic emergency.
Deep breath for me.
This is an ever-growing and expanding career field, but we're losing many providers to other allied health fields working in emergency rooms, doctor's offices, cardiac cath labs, or going on to advanced careers as physician's assistants or doctors.
Quick pinch, 1, 2, 3.
Our challenge has been to keep up with the growing demand for new providers. Recently, the JCC EMS program started a new hybrid paramedic program in collaboration with North State Medical Transport to train entry-level paramedic providers to work in their mobile integrated healthcare initiative. The classes run on a compressed 9-month schedule to graduate new providers even quicker. The Perkins funds we received this year were used to purchase advanced airway training equipment. This equipment is used for formative skills training as well as summative testing scenarios and competency evaluations. Having functional and current industry standard training equipment also serves as a recruitment tool for our program.
Charge.
Nationally, women and minorities are significantly underrepresented in the EMS profession, with females who earn an initial emergency medical technician certification hovering around 35%, and minority racial ethnic groups at about 27%. Paramedics, the highest level of pre-hospital credential, often provide more critically invasive interventions and make complex, time-sensitive decisions regarding patient care as compared to EMTs. The gender and racial ethnic gaps are significantly more pronounced among paramedic providers. The JCC paramedic program has managed to stay ahead of the curve with recruitment, with approximately 50% of our 3 current cohorts being female and 10% being racial ethnic minorities. Our paramedic interns are required to perform 12 hours of community service. To expand our recruitment efforts, this spring we visited 6 of our local high schools where our paramedic interns talked about the profession and also taught hands-only CPR to approximately 700 to 800 high schoolers. 3 of our paramedic program graduates talk about the profession and their experiences at JCC.
EMS is about being the difference between life and death. It's being the person that's there in some of the best moments of somebody's life and being there in some of the worst moments of somebody's life. It's making the difference and being that helping hand to somebody who may not necessarily have that helping hand on a normal basis. I've been a paramedic for quite a while now, and there isn't any other profession that I would choose to do. It's definitely my calling. I love being there and helping people, just working with the community in general, but in overall making a difference in the world. And I feel like this is my small little piece, of the bigger puzzle, you could say.
I chose JCC mostly because of the percentage of pass rates for their state exams. I wanted to go somewhere where I knew that I was getting a quality education, and I knew that I was going to be prepared to take my exam and eventually enter my field of choice. And so far I feel that JCC has thoroughly prepared me to not only pass the exam, but to provide quality care to my patients within the scope of a paramedic.
Growing up in the inner city, you don't really have a lot of options. The resources aren't there all the time, and I know what that's like. So if you are indecisive, talk to your advisor and see what is out there. And public safety is for everyone, in my opinion, and it gives you the options of going fire, EMS, emergency services in and of itself. So I would say give it a shot. It is a rewarding career, very rewarding, and I never dreamed that I would be a paramedic growing up. So at 29 years old, here I am loving it each day.
Being a paramedic, EMT, AMT, it doesn't matter. It's a job for anybody. It doesn't matter the gender, the race, none of that applies, because we are one big family and we are able to be there for each other and help each other. And we have more women coming into this profession, and it is wonderful to see, because we are just as strong, we are just as smart as the men. But in general, I mean, like I said, this job is for anybody.
All right, so we would push our epi.